Do you have heartburn, acid reflux, GERD, maybe even Barrett's esophagus, bloating, indigestion, and you've been put on proton pump inhibitors like Nexium, Prilosec, omeprazole, or maybe that you're always taking Tums and Rolaids all the time? These are acid blocking medications and they can really dramatically affect your health. Watch this video today to find out more about how these medications are affecting your health and what to do to work towards resolving the problem. A very common thing that I see in practice every day is the use of proton pump inhibitors by people. Those are the Nexiums, the Prilosecs, even the Tums, Rolaids. Another name is omeprazole. These are antacids that when you take them, they suppress and decrease the stomach acid within your stomach. And a lot of times the doctors are telling people that the reason that you have heartburn, acid reflux, Barrett's esophagus, indigestion is because your stomach acid is too high. And what's happening in there instead is that there's actually been so much irritation happening within the stomach that now there's a wound in there, and the same level, like the same acidity of stomach acid is now basically burning that wound, and so it's more sensitive. And so then you're prescribed these medications or take the over-the-counters, and many of them are over-the-counter now. And so you treat the symptoms, and the acid actually increases its pH, so it becomes more basic. So it's not as acidic, and so some of the symptoms can go away. But it's a huge issue to actually to decrease the acidity of stomach acid, because a couple big reasons why you need stomach acid is that stomach acid is designed to break down foods and vitamins and minerals. Some of the big vitamins and minerals that you hear out there right now that people are using for their immune systems are things like vitamin D, vitamin C, magnesium, zinc, B12. Guess what? For all of those things to break down, all of those vitamins and minerals to break down in your body, you need strong stomach acid. So if you're taking a proton pump inhibitor, an acid blocker, you're actually going to decrease your ability to absorb and use those type of minerals. And then therefore you're really not making any headway as far as your immune system. You're actually putting more stress into that system because of the stomach acid being too or not acidic enough, and you're also taking a medication to manipulate the body to keep that stomach acid not acidic enough. Another big reason to have good stomach acid, and the reason like proton pump inhibitors and these acid blocking medications are bad, is because you need good stomach acid to kill off bugs as they come into your body. Viruses, you definitely need good strong stomach acid. Bad bacteria, think like H. pylori, C. diff, E. coli, Giardia, parasites. You need strong stomach acid to actually kill those off as the foods are coming into your body. If you're taking proton pump inhibitors, acid blocking medications, you can actually allow more things to get into your gut, your digestive system, which is actually somewhere between 60 to 80% of your immune system, is what research has been showing over the years, is that about 80% of your immune system is within the gut. So if you want to have a strong, healthy immune system, you better have the ability to break down foods, nutrients, kill off bugs that aren't supposed to be coming into your body, absorb the vitamins and minerals that you need in order to be well, stay well, prevent sicknesses and illnesses from happening, to have a stronger immune system. And so, coming back around a little bit, I see this world that's going on right now, and people are trying to do things to support. And what I hear is strengthen their immune system. But then on the other side of the coin, they're over there taking in a Tums or a Rolaids or a Prilosec or Nexium. So they're taking things that are suppressing the body, and they have no idea. And they're trying over here to do these healthy things, but they're going to be inefficient, insufficient if you're blocking and dropping that the acidity within the stomach, meaning, again, that the stomach acid is not acidic enough. And so if you do have acid reflux, you do have GERD, you've maybe even been diagnosed with something called like Barrett's esophagus, you've got to find out why that's happening, because to have those symptoms and conditions, those are not the cause of the problem. It's what's causing those things is the cause of the problem. And you could have infections like H. pylori. H. pylori, if you look that up, has a main contributor to stomach ulcers and stomach cancer. So has anybody ever tested you for that? Have you ever looked at food antigen testing to see what foods your immune system's basically adapting and reacting to. Have you had conversations around getting off of medications, those acid blocking medications? Because one of the things to remember is that, having acid reflux or GERD or heartburn or Barrett's esophagus, it's not a proton pump inhibitor deficiency. It's not an acid blocking deficiency. It's actually that there's something irritating your stomach. There's a wound in there. There's wounds in there. And now you're feeling it. And where you really basically have the same level of acidity in there, but now because of the wounds, now it's more sensitive. So you got to find out the cause or it'll continue to get worse. Having stomach issues is a big time immune system problem that affects the whole rest of the body. To learn and find out more about functional medicine, go to my website, drgunyon.com. That's just drgunyon.com. To find out more about functional medicine and our unique approach, our story, and I say our because it's my wife and I. She became very ill, and that's what led us to functional medicine and finding clarity about evaluating and finding root causes and why the body changes and expresses symptoms.